So before we talk about the spinal muscular atrophy, just know that we have 4 types. But the most common and severe, and the one you'll get asked about on your exam, is type 1, or the Wernicke-Hoffmann syndrome. The idea is pretty simple. Basically, there's an autosomal recessive mutation in a gene called the SMN1 gene located on chromosome 5q, or the long arm of chromosome 5. Chromosomes have a Q arm, which is the long arm, and a P arm, which is the short arm. Autosomal recessive means that the patient needs to receive 2 mutant alleles of the gene to present with the disease. 1 allele from the father and 1 from the mother. So the patient gets an autosomal recessive mutation of the SMN1 gene, which is located on chromosome 5q. Why is that a problem? Well, let's first know what the SMN1 gene normally does. The SMN1 gene stands for survival of motor neuron 1 gene, and this gene helps make a protein called the survival of motor neuron protein. Now, I'll get into more depth of how exactly this protein works in the biochemistry molecular lectures, but for the purpose of neurology and this lecture, just know that the SMN protein is important in the function of anterior horns of the spinal cord, because it forms a complex that can ultimately help in removing introns. Introns are the non-coding, useless parts of the genetic material. So if there is no SMN protein, these non-coding portions of the genetic material will not be removed, and this will cause a dysfunction and degeneration of the anterior horns of the spinal cord. Now you can easily predict how this patient will present. This is mostly pretty similar to poliovirus with a few differences. There are damaged anterior horns, so the patient will present with lower motor neuron signs. But unlike the poliomyelitis, the spinal muscular atrophy type 1 is caused by a mutation and will present congenitally at birth, which is why we call it the infantile form of spinal muscular atrophy. So the patient will be a floppy baby with marked hypotonia and tongue fasciculations. The baby may have a flaccid, frog-like posture. And unlike the poliomyelitis, the muscle weakness will be bilateral and symmetrical. In poliomyelitis, the weakness was bilateral and asymmetrical. Sadly, this condition is pretty severe and the median age of death is 7 months. The patient may live for a few years at best. Few people can survive this SMN1 mutation though, and we believe it's due to the fact that we have another gene in our bodies called the SMN2 gene, which produces the same survival of motor neuron protein of the SMN1 gene, but in a lower amount. So this knowledge helped us to come up with a drug that can be used to prolong life in these patients. It's called nusinersen, and it works by alternatively splicing the SMN2 gene to make it produce as much SMN protein as the normal SMN1 gene.